Hello and welcome to McLaren Port Huron's Today's Health Program. I'm your host, Michelle Baker. Today we'll be talking about common health concerns associated with obesity and available treatment options, including bariatric surgery. Joining me now is board-certified general surgeon, Dr. Zubin Besenia. Doctor, thank you for speaking with us today.
Thanks for having me.
Now, you are the medical director for the Bariatric Center of Michigan for McLaren Port Huron. Can you tell us what sets this program apart from others?
Well, this is a program that went through accreditation, and we have surgeons that offer the three main bariatric procedures done in America today. So we offer the band, the sleeve, and the bypass. And we actually track data at the center, and so all our patients' outcomes are tracked, the complications are tracked. So the center is really an important tool for weight loss, and we're able to have good results and perform the surgery safely.
Now let's start with what is an overview of obesity?
Well, obesity, simply stated, is extra body fat, okay? And what happens when you have this extra body fat on your body, it creates other health problems.
Now, what is it about obesity that keeps it in the news?
Well, we've had an explosion of obesity over the last 20 years. And if you look around, you'll see that it's a very common problem. And what's happened in most developed countries, that there's been this rapid rise in weight, and with that comes all these different health problems. And what's occurred is health insurance companies have realized that they're spending a lot of money treating the complications of obesity, and there's been more awareness of obesity, and then there's been treatments available for the last several years for obesity.
Now, there are a lot of people who will dismiss obesity as a matter of self-control, but research shows that that really isn't true. What are some of the factors that can lead to obesity?
So obesity is a complicated problem. There are genetic factors, there's cultural factors, there's issues with people and how they treat food, so there's psychological factors. They're all involved with obesity. Part of the problem is our diet in America has this increase in high carbohydrate load, which has sort of stimulated this obesity problem.
Now, what are the most common health issues that are associated with obesity?
Well, obesity is a problem that will affect you from your head to your toes. There's about 40 different diseases that are associated with obesity, but the top 5 diseases are high blood pressure or hypertension, diabetes, sleep apnea, reflux, osteoarthritis are the main things we see with obesity.
Now, how does bariatric surgery help with obesity?
Well, a lot of the health problems associated with obesity are reversible with weight loss. So if someone's a diabetic, if someone has high blood pressure, someone has arthritis, someone has reflux or sleep apnea, they all improve with weight loss. And so if you have these conditions, one of the first treatments your doctors will talk about is weight loss. And it doesn't have to be surgical weight loss, just dieting to lose weight. And in my own practice, I've seen people that are on 10, 15 different pills a day before surgery, and then they lose weight. It doesn't have to be all their weight, but lose 30, 40 pounds, and next thing you know, they're down to 2 or 3 pills. So it's amazing that the weight is dramatically affecting your health, and when you lose the weight, your health improves.
So surgery, although it is a big step to some, the benefit of it really is that you can reverse these diseases that result from the obesity.
Correct, and that's why bariatric surgery has sort of exploded over the last decade, is because we're able to help people and prevent complications from obesity.
Now, who is and who is not a candidate for bariatric surgery?
The people that are going to go through bariatric surgery are defined by their insurance companies. So the insurance companies have defined a BMI of 35 or greater, and BMI stands for body mass index. It's a ratio of your height and weight, and they put it into a formula and they have a number. So people who have a BMI of 35 or greater are the ones that are considered for bariatric surgery.
Are there other health conditions that they have to have in order to be a candidate?
Typically, when you hit a BMI of 35, you will have some other health problems associated with it, so it's almost universal that people will have some issues. We do have some young people that get operated on that do not have an issue, but their weight is the requirement.
Now, doctor, we know that having surgery will assist those individuals with obesity and losing weight, but what are some other things that they need to do in order to ensure their success?
Sure, patients need to understand that surgery is a tool for weight loss. It doesn't guarantee weight loss, so you have to do some personal changes. So what you eat is important. So if you need to eat the right choices in food, exercise will help, and then follow up with your doctor after surgery is a key part of the surgery, to track your labs, to track your outcomes, to make sure you're avoiding any complications of surgery.
Doctor, this is great information. We need to take a break. We'll continue in a moment.
Thank you.